by Dr. Bidisha Mahapatra on eyelid lumps and bumps, a 5-year survey from a tertiary eye hospital.
Good morning. I am going to present my paper on eyelid lumps and bumps, a 5-year survey from a tertiary eye hospital. Eyelid growth is a common clinical condition presented to the ophthalmologist. Pathological conditions may range from inflammatory to being neoplastic. 90% of the skin cancers occur in the head and neck region. 10% of them are located at the eyelid level. Benign epithelial lesions, cystic lesions, and benign melanocytic lesions of eyelid are very common. Among the benign lesions, squamous cell papilloma, seborrheic keratosis, and melanocytic nevus are common. Most common malignant tumors of the eyelid are basal cell carcinoma, squamous cell carcinoma, and sebaceous carcinoma. Basal cell carcinoma are most common malignancy of eyelid. The incidence of eyelid skin tumors show geographical variation, mostly as a result of environmental factors including sunlight and ultraviolet exposure, and genetic factors including skin pigmentation. Aim of our study was to evaluate the demographics and clinical features of eyelid masses in a tertiary hospital over a 5-year period. It was a retrospective study conducted between June 2012 to May 2017 based on review of the hospital records of 96 patients with eyelid tumors who had undergone biopsy of the lid lesions were included. The lesions occupying less than 1/3 of the eyelid were excised and lid repaired by direct suturing. Occupying greater than 1/3 of the lid lesions were excised and lid repaired by tensile semicircular flap, and greater than half of the eyelid involvement of the lesions were excised and lid reconstructed by Cutler bed tarsoconjunctival flap. After excision, the specimen was subjected to histopathological examination. Data was collected and analyzed on demographic features, location of the tumor, treatment given, and pathological findings. The results were the most common benign lesion was that of melanocytic nevus, followed by papilloma and cysts, while the malignant most common were basal cell carcinoma, followed closely by sebaceous gland carcinoma. Less common ones were squamous cell carcinoma, metastatic. There were 56 females with a slight female preponderance, and overall male is to female ratio was 5:7. Coming in both benign and the malignant groups, females were affected more. Benign tumors were more prevalent among females, while in the malignant group there were slight female predominance seen in patients with sebaceous gland carcinoma, while there was slight male preponderance seen in patients with basal cell carcinoma. The mean age of presentation of the malignant lesions was 57.9 years, while that of benign lesions was 40.6 years. Most of the benign lesions were located on the upper lid, while sebaceous gland carcinoma mostly involved the upper lid in 85.7% of the cases, whereas the basal cell carcinoma was mostly seen in the lower lid and the medial canthus. The types of procedures the patients underwent were mostly excision and biopsy in most number of cases, followed by tensile semicircular flap, which was done in 14 cases, and incision curettage, and mustard stick rotation flap and Cutler bed's procedure were the other procedures which were done. Coming to discussion, in our study, most of the cases were benign eyelid tumors, that is 79.16%, which correlated with the rest other of the studies, except few studies like Abdi et al. And Bagheri et al., who from Tehran, and they have reported a lesser incidence of benign lesions. In our study, the most common benign lid tumor was nevus, followed by papilloma and cysts, while there were 3 separate studies from China, southern Taiwan, and South Korea had reported frequent benign tumors in descending order of being nevus, papilloma, and cysts. The most prevalent benign masses in this study by Kirsten et al. And neva papilloma. In the study by Su and Lin, the most frequent type was dermoid cyst. In our study, 65.78% benign lesions were located on the upper lid, which correlated well with some other studies from Thailand and southern Taiwan. In contrast, from Beijing, Zhu Li et al. Has reported lower eyelid as being most frequently affected than the upper eyelid. Sebaceous gland carcinoma mostly involved the upper lid, whereas the basal cell carcinoma mostly seen in the lower lid and medial canthus. Various studies have reported greater number of sebaceous gland carcinomas cases in the upper lid. This preference is linked to relatively greater number of meibomian glands located in the upper lid versus the lower lid. In general, 20% of the basal cell carcinoma occur in the periocular area, of which half of the cases are present in the lower eyelid, 1/3 in the medial canthus and the upper lid and lateral canthus. In our study, the most common malignant eyelid lesion was basal cell carcinoma, followed by sebaceous cell carcinoma. Worldwide, basal cell carcinoma is the most common eyelid malignant tumor. However, in the Asian countries like Thailand, India, Japan and China, studies provide evidence in favor of higher proportion of occurrence of the sebaceous gland carcinoma, while from Central India, 2 studies by Sciota et al. And Kale SM have reported almost an equal incidence of sebaceous cell carcinoma and basal cell carcinoma. In our study, the mean age of presentation of malignant lesions was 57.9 years, while that of benign lesions was 40.6 years, which correlated well with other studies by Wang et al. And Rathod et al. In our studies, the females were more affected with 7:5 ratio of females to male. In the malignant group, sebaceous gland carcinoma affected more the female. This is a case of a 40-year-old lady presenting with right eye upper lid tumor. Had history of Calazian surgery twice in the past in some other hospital, and was histopathologically, when excised in our hospital, histopathologically proved to be sebaceous gland carcinoma. There's another case of right eye upper lid tumor in a 60-year-old male, which underwent Cutler bed lid construction after excision and was histopathologically proved to be squamous cell carcinoma. There is another case of right eye upper lid tumor, which was non-ulcerative and like skin looking, and it was excised and reconstructed using tensile slab reconstruction. Histopathologically showed trichoepithelioma.
Please summarize.
To conclude, eyelid malignancies are completely treatable if detected early. Eyelid tumors are rarely lethal, but late diagnosis requires more invasive surgery and will have adverse aesthetic effects. Early diagnosis of eyelid growth is thus of extreme importance to avoid high morbidity and mortality. Thank you.
Your presentation is again more clinical rather than pathological. And what about the vascular eyelid lesions in your series, like hemangioma, pyogenic granuloma, etc.?
Sir, I did not get
No.
hemangioma, sir.
Okay. What was the age range of your patients?
So mostly 30 to 70 years of age group, sir. Except for the cysts, which were most common in pediatric groups also, like dermoid cysts.
That's why pediatric groups are very less.